Welcome back, everybody, for the session on COVID-19 and eating disorders. What a topical content that is. To introduce the discussion, and you can see her on screen now, please welcome the President of Eating Disorders Association of New Zealand and the immediate past chair of F.E.A.S.T, Nikki Wilson. Over to you, Nikki.
Hello, everybody. It is my great pleasure and actually my honour to be here. And I'm really delighted to be meeting Dr. Jennifer Gaudiani for the first time. Hi there. And welcoming Shannon again. Shannon, who I've met several times and often, and it's just such a pleasure to know you. What I'm going to do is actually hand over to Dr. Gaudiani and to Shannon to run this session completely, but just to introduce it for those of you who may not have looked at your programs. Dr. Gaudiani and Shannon are going to discuss the impact and the experience of those who are struggling with eating disorders and the people who are supporting them, and what that's like and the implications for that in this environment that we're all in worldwide at the moment, with COVID-19 presenting new and really significant challenges for people and for those with eating disorders and their carers who are often desperately trying to access the support and the treatment that they need. The strain is often even greater. This is a short session, and I know that Dr. Gaudiani and Shannon have both spent some time talking about it prior and have got lots that they'd like to share with you. So I'll hand over to you two. Thanks very much.
Thank you so much, Nikki. What a joy it is to be here. And hi, Shannon.
Hi, Jen. How are you going?
Oh, just great. It's so lovely to be here with you and with these wonderful people.
I agree. Thank you so much. And Nikki, thank you so much for a lovely introduction. And before we start, I also wanted to acknowledge all people with lived and living experience here that are attending, both carers and people with a lived experience of an eating disorder, and clinicians and professionals as well in the field. So thank you all so much for this time.
That's really lovely. Shannon, would you like to start by telling these good people who you are?
Yes, of course, Jen. Sure. So hi, everyone. So I'm Shannon Calvert. I identify as a person with a lived experience of having a severe and enduring eating disorder for almost 3 decades of my life. I currently live in Australia and work in the field as a lived experience advisor and systemic advocate in the field of eating disorders, mental health, and palliative care.
Beautiful. For my part, I am obviously American. I'm in Denver, Colorado. I am an internist who specializes in eating disorders. I've been in the field for a little over a decade now. My sister had an eating disorder. I have not. I like to acknowledge my privilege at the start of conversations to say that I'm aware that I'm a white, thin-bodied, cis, hetero, able woman who has the financial means to be here and to do my work, and that I recognize that does not reflect the lived experience of those whom I treat, their carers, and their teams. And I continue to try to be aware of the privileges that affords me. My experience is with, for 8 years, patients with really critically medically unstable eating disorders. And then for the last 4 years, in my clinic called the Gaudiani Clinic here in Denver, Colorado, I care for individuals of all ages, genders, body shapes, and sizes. I care for the medical aspects of their eating disorders in concordance with a lovely multidisciplinary team, seeing patients around the United States. And I'm a passionate, health at every size, weight-inclusive provider.
Thanks so much, Jen. And I think this just resonates so strongly how, in terms of moving forward, how me in Australia here and a person with lived experience, and yourself in the space of clinical practice as well, where we can sit across from across the seas and have this conversation online. And in terms of acknowledging sort of challenges and diversity and and the fact around privilege. I mean, this world has just turned upside down significantly in the past 6 months, especially, which, and just to share a bit with the audience as well, Jen and I came together just to have this conversation, and we thought it would be just best to have this organic chat between us, acknowledging that many of you out there will also have questions and thoughts about COVID-19 and eating disorders and beyond that experience. I think what's so wonderful as well, Jen, and can I certainly acknowledge that, just the area of work that you do. And I know for myself as a person with lived experience would always look at the information that was coming forward from your experience and going, oh, thank goodness, things are moving forward. But in terms of how this conversation also wanted to come together, I had been contacted by people in the clinical field as well, reaching out to me saying, how can we get information out there to families in the communities to be able to support loved ones, significant others, people that we cared for in the community, especially during such times of isolation, especially considering that is an experience that eating disorders would feed off, times to kind of isolate, be secretive, be quiet, no one knows. And also, I know for me as a person with lived experience, that need for certainty was something that I felt more confident in existing in. And now all of a sudden the world around me was becoming incredibly uncertain. And I can imagine that experience has been, for people with eating disorders and their loved ones as well, and even clinicians. So I guess maybe it's just best for us to share a conversation in terms of how we're dealing with it, how have we dealt with it, where we see the concerns and maybe the opportunities moving forward as well. So I'm just wondering, I was wondering for you, Jen, how much things have significantly changed in your field and in your area of work?
Well, I've been incredibly lucky, Shannon. I already had a telemedicine platform because I see individuals from around the United States. And so I've converted since the middle of March to an entirely telemedicine platform that feels like it's the safest and most respectful to my patients, to their families, and to my own staff. And so, what I've witnessed is an incredible upsurge in suffering and struggling. The change in routines, the uncertainty, the conversion of that vital in-person embodied experience with therapists and dietitians, sometimes with physicians as well, has been incredibly difficult for my patients across body sizes and shapes, across eating disorder diagnoses. It's been a hard time. And of course, we know that individuals who suffer from eating disorders very frequently are exquisitely sensitive to a changing and suffering world. So this is really, as you said, Shannon, a time when the eating disorder, whom we always have to remember, if I give it a voice, we can't entirely cast it in the role of something who's evil or abusive. We have to really respectfully understand that the eating disorder thinks on a very misguided level that it's keeping its person safe. Mm-hmm. And so a lot of my patients have really sort of turned inward back to eating disorder behaviors that they had been able to put aside for a while. And they then experience both the tantalizing experience of sort of acting on those behaviors again, and also the shame of moving away from their values and goals as they engage in eating disorder behaviors.
Yeah. I think it's interesting, actually. For myself, hearing what was happening around in the community, and unfortunately, in terms of food shortages and just that concern and anxiety around, I just remember having a specific brand that I would use to be very reliant on, and then all of a sudden that was becoming scarce. And I know for me, I could sort of reflect and have some insight and perspective on that, and just go, or just get a different type. But I could imagine when in the sort of in the deep dark sort of realms of my eating disorder, those sort of things would be a challenge. There was a couple of concerns as well, which I'm sure came up in treatment for many, but again, reflecting on lived experience, was for those that were in the single household or just on their own and living on their own, in terms of having the ongoing supports around them. I guess I saw an advantage in some ways where people in general, not just with those with eating disorders, but say people in the community, we all just stepped up. Everyone started to reach out to our neighbors, to those that we cared for and loved. And I could see this happening in eating disorders. I could see people reaching out saying, how can I support someone I care for that lives on their own? And I felt that as a huge, wonderful thing that people were courageously doing. I guess my one concern around that is that that doesn't continue. And I would strongly encourage people to say that if we can show our wonderful human values and reaching out to one another, that we continue to do that in terms of supporting one another with an eating disorder, because indeed that isolation has been detrimental to many initially in terms of, for some it's about relapsing as well. There was more of a sort of being isolated in that experience and then it's starting again. But then it was also just a way to say, actually, we don't have to do this alone. It was just one of the experiences where we could reach out to clinical support, even online, whether it was even via telehealth, reaching out to some form of peer support or meal support. I've seen clinicians step up to the plate, second to none, here in Australia, overseas, where I can only imagine the challenges that many had to rush into, and having to set up an online platform, for example, and adjust the way of working and managing conversations with the person via telehealth versus in the room, and being able to identify and understand more about body language. So there's been so much to adjust and change to, but I don't know, I'm seeing eating disorder sector has really stepped up to the mark, and we're making it happen, in terms of how we're able to have these really vulnerable conversations and identify, these are difficult times for us, and what can we do to help each other?
Well, I think that's so right. And there's two thoughts that come to mind. One is that no matter how far through the process of complicated, non-linear recovery someone is, there's going to be a part of them that has that little gremlin of the eating disorder on their shoulder, looking at the world and trying to wait for that minute to kind of jump back in and have primacy again. And so a number of my patients, as COVID began, said to me, well, Dr. G, it seems like everyone's suffering, so I can too. And I looked at them really lovingly and I said, not everyone's my patient. You get back on your meal plan. I think we have to remember as clinicians that we can hold our beloved patients, that as families, we can hold our loved ones with compassion, with validation, and say, no, sir, not today, eating disorder. Nope. Exactly. I understand why you would find space here. But we're going to continue to honor this miraculous body. We're going to continue to focus on rest and nourishment. And I think all of us right now, carers and individuals who have eating disorders, family members, clinicians, all of us can recognize the importance of taking that deep breath and saying, in these challenging times, which will affect us all differently, what do I need to do to rest and recharge and show up for my life?
Yeah.
Oftentimes right now, people are needing extra peace. They're needing extra naps, extra cuddles, extra snacks, extra sits in the garden, breathing the fresh air, extra, if it were me, fantasy book reading. The things that make us well and whole, this is really the time to remind ourselves we all have to engage in those aspects in order to be strong and do what we need to do.
Yeah. And I think that that's such a good point, but I'm so glad. And I know for me, I would always want someone to have my back and have that upper hand over the eating disorder, if you will, or just in terms of the challenges and sort of that seduction to almost when it's quiet or when you're alone or when things are uncertain and unreal. And I don't like to use the word control too much because I think it's used sometimes a little bit too much, but I do understand that need for structure and routine. And I I always feel so comfortable and so confident saying, yes, we've got this. When people say, yep, no negotiations around, when it comes to your eating plan, when it comes to what you need to do, that needs to be put in place. I think the biggest challenge sometimes is, oh, well, I'll do it tomorrow. And I can understand that because routine is different, or there isn't necessarily that same follow-up of checking in, whether it's physically going in to see the person who's supporting you professionally. But I think always holding on to that, get back on track. Because I think for us, in terms of what we've already implemented in management and in support, is there. And I think in whatever circumstances we're faced with, I think those are the resources that we have, that we can say, hey, you know what, we've developed these, and wow, how great is that? Like, we can hold on to these, and then we can utilize these in all times of challenges and concerns. I can see how it could be a challenge for parents and carers at home who've had to isolate more at home, and obviously things are changing. I mean, I can imagine that for those having to manage not just one child, but several children, not wanting to cook all the time and then having to order takeout, and that's really challenging someone that they have in the family with an eating disorder as well. So we're all certainly having to adapt and adjust quite significantly. But I just feel that I've also noticed, Jen, and I'm not too sure about yourself, that even in terms of those that have already experienced the eating disorder and have these things implemented and put in place, I've also seen people have courage and step forward and ask for help.
Yeah.
And I'm sometimes curious what's come to that. Has it been more time for self-reflection? Has it been more times to say, maybe it's not having to step into an office or into a room or to have to engage face-to-face and have some security to reach out online?
That's been my experience as well, actually. I've seen a number of new patients since COVID started who found that while this extraordinary disruption in routine and fear on a number of different levels around the world have been distressing and challenging, the change in the day-to-day tasks have given them an opportunity, whether they themselves are parents raising children or whether they themselves are adults living outside of their families of origin, or young people, to say, oh gosh, this actually isn't working for me. Let me use this time when I'm not doing extracurriculars, the kids aren't doing extracurriculars, when we're all sort of hunkered down in our home. Let me use this time to really rethink, is it time to address my eating disorder? Which, anything that gives that mindful opportunity is important. And I want to say as well that as folks went through that initial seismic jolt of, oh my goodness, the world is really changing and things are at risk that I thought were safe, the challenge and the thing that families can helpfully remind their loved ones is that avoidance always strengthens anxiety, while exposure strengthens confidence.
Yeah.
And so, in the moment where the eating disorder says, batten the hatches, things are, I'm freaking out, and wants to constrict either what's being consumed or what's being done, in that moment, lovingly reminding them, oh gosh, I get it. Right now, going back into your eating disorder is so tempting because it feels safe and known. It feels distracting. It feels sort of countable. But my darling, the more you engage in avoidance, the more it empowers your anxiety. And the more you keep bravely moving forward and exposing your body to the experience of being beautifully nourished, a wide variety of foods, the more you will stay true to your values and stay confident. I love reminding my patients of that. And of course, they say, yes, that is true for me.
Yeah. But Jen, I love that. And I think sometimes, as much as we ourselves can have insight and sort of critically reflect on our own thoughts and feelings, to have that validation from a clinician or a person who's supporting us is just crucial and so empowering. And I guess that's one thing that, just hearing you say that and I couldn't reiterate more, is especially for those that have sort of been exploring recovery or that potentially in recovery or have learned to identify their eating disorder and have bravely said, this is a concern for me, this is a problem, that those times of lapsing, those times of actually where things just didn't go well, that day where things didn't go well, I guess that one way to always look back on it is to sit and say, acknowledge it and name it. Yes, this today was a screw up. And even as parents and carers to go, God, that's a bugger, that happened. But can I say that we have the potential, and many of us have, we get up, and at times, yes, we fall, and at times we fall so hard and we don't want to get up again, but we can get up and we must get up. And I think it's the same thing as having a loved one and a support person saying, you know what, yes, you fell and that's okay. So what can we do to get you back up again? Because you're going to get back up. And I think it's about saying that to ourselves. It's about saying, I'm not doing this perfectly. I'm in struggle. Today wasn't a good day, but tomorrow could be a better day. I need to go in this with face forward, knowing that I've done it before and I can do it again. And I think when you hear someone of support and of love, as hard as it must be for them to say the same thing to you, and to them acknowledge that disappointment internally and name it and go, oh God, this is frightening and I hope to God my child doesn't relapse completely. And I think sometimes that naming it, Jen, really just disempowers it more, doesn't it? It just doesn't give it as much of a hold.
Well, and what I love about what you're saying, Shannon, is that the words you're using that are so compassionate and wise actually apply not only to those suffering with eating disorders, but to their carers as well. Because all of the carers, and my sister had an eating disorder and came through it, and she was the one who inspired me to get into the field. All of those who are carers have their bad days too. They have their days where they stumble over their words. They themselves don't show up embodied in the way that gives the kind of role model and support that might be hoped for. And I think my favorite word during this entire 3-month period has been gentle.
Yes.
Gentle.
Yeah.
It's okay. Try again. It's all right.
I love that, Jen. I think I always sometimes sign my emails off as go gently, because I just think that that's so important. And can I just also acknowledge that, even though we're talking about eating disorders today, COVID-19 has impacted the world. And let's be honest, we're not over it yet. We don't know if there's going to be second surges. And these are all things that we have to be mindful of and prepared for. But this has thrown everyone's world upside down, eating disorder or not. It has thrown clinicians and professionals' worlds upside down. Parents, carers, loved ones. I think, in all fairness, I think we all need to acknowledge that this has been quite a significant change. And I, like I said, here in Australia, I can speak on behalf of Australia. We've learned to identify that everyone stepped up to the plate. They put things up on telehealth. What about people in rural and remote areas that couldn't access care? Now, all of a sudden, these ways of practice and have started to be implemented as well. So there are definitely strengths that we need to hold on to in all of this and say, you know what, how strong are we? How strong are we in just under such diverse circumstances where, in terms of the challenges that we've faced, we're making it work as best as we can.
Yeah, I think that's right. I think it's also important to think a little bit about what are the risks to people with eating disorders from COVID. We're talking about the influence of the experience socially, internationally on individuals, but what are the risks of the disease itself? And of course, it's too early for us to have data that we can really speak to. But I have some theories, and my philosophy is deeply grounded in the social justice model. I wrote a blog that's available on our clinic website, which is www.gaudianiclinic.com under the blogs, in which I imagined what might be the risks of someone with an eating disorder getting COVID, because just now, many of us are starting to peek out of our turtle shells again and say, oh, we have friends and loved ones out there that we've missed and we want to see. And, different countries are experiencing different levels of risk. I think that in many ways, the US right now is experiencing a resurgence. And I acknowledge that we have not managed this epidemic and this pandemic well at all. But I think that a lot of individuals and their loved ones are saying, when can I get back to normal? Because that's just such a longed for, yearned for state. And I think we have to think about a number of really key issues. If we subsegment by eating disorder type, I would just like to say, for starters, that I always put so-called atypical anorexia nervosa and anorexia nervosa in the very same category. I deeply dismiss the DSM's choice to segment those two based on a weight cutoff. It is sizist and unacceptable. So when I say anorexia nervosa, I'm referring to individuals who restrict in all possible body sizes. I think if somebody in that category gets COVID, first of all, it's really important to know that hospitals aren't going to know how to nourish somebody who's been malnourished and is now quite ill and has even higher caloric need. So there is a risk in hospital of getting missed, especially as hospital systems are stressed and hospital personnel are trying to sort of do the best they can to triage and manage. But we all here know that those who are primarily restricting calories, regardless of body shape or size, are going to have significantly higher caloric needs in hospital. What will happen to them when their families can't access them and when the hospital system is stressed? Really important to recognize that. Also, for those who, again, in all body shapes and sizes, are emerging into COVID with weakened muscle systems, it's really important to be strong enough to cough. It's really important to be strong enough to take a deep breath. And those who are malnourished cannot do that fundamentally as well. So I regard anyone with an eating disorder as at higher risk from serious complications of COVID, not to mention the psychological impact of needing to be left in hospital without your support team around you and what that impact would have. I think for those with bulimia nervosa, it's really important to recognize that the act of purging regularly can set off something called pseudo-Bartter syndrome or secondary hyperaldosteronism, where the chronic dehydration leaves someone at risk of rebound edema or swelling when purging stops. Hospitals don't know how to recognize this. And of course, the act of getting critically ill involves tons of intravenous fluids. So the impact, both physiologically and psychologically, of someone who goes into hospital having been purging a lot and then stops because they're critically ill, they're going to go through medical complications that hospitals aren't equipped to take care of. And then those with binge eating disorder may have risks as well. Of course, they have a very strong restrictive component of their illness. And for any individual who goes into hospital in a larger body, and of course, not everyone with binge eating disorder is a larger body, nor vice versa, but there's a real risk of weight stigma and a triaging of resources away from that individual. So I think I say that not to make people fearful, but to say, I take this very seriously. I take this really seriously, and we've got to protect and nurture and support our loved ones with eating disorders until things are safer.
I agree. And one thing, I guess it's just goes to show, Jen, there's so much more to, more of a conversation that we need to have along the way. But from my understanding as well, a lot of people are reaching out in terms of clinicians to say that further research will need to be done around the impacts of COVID-19 and those with eating disorders. And so I can see that there's been a lot of advocacy that happens and gets put into place, so that as we move forward in the future as well, that we will understand the implications and how to best manage these types of circumstances that hit us left field. So
can I just jump in here? Thank you so much. Sorry, there's a very loud noise motorbike outside my house. I hope that that's not disrupting everybody. That's been a really insightful, thank you, and helpful discussion. And we've had a few questions, and I know we're coming to the end of our time, and I wonder if I could just stop your flow and put a couple of points to you that perhaps you might like to answer to. And in fact, most of them are around people's carers' concerns about the medical, the vulnerability of their loved one to becoming even more ill because obviously they're compromised with an eating disorder. And you've discussed that really nicely. But just to pose a couple of specific questions, somebody has asked, we used to bring my son to the ER during times of food refusal as leverage, but now I'm afraid to bring him in because of the risk of COVID or because our situation won't be taken seriously. What would you advise?
I think the first thing to say is mamas and daddies out there and all carers of all varieties. As a medical expert, you remain the experts in your loved one. I may have an MD, but you are the expert. And I just want to give back with so much love and support my belief in you as having the best spidey sense from a superhero perspective, that if something is going wrong, you pull out the stops. You do whatever you need to do, whether that's reaching out to your GP, your therapist, your dietitian, your local eating disorder organization, anything you need to do. I believe that you are correct in your fear. And the community around you is going to also appropriately validate and support you. Many of you have experienced being in the emergency department and not getting validated. Oh, the labs are fine. Oh, he just looks like a healthy young boy. Take him home and give him some ice cream. So I think what I want to say is, I don't have a specific answer to that. But what I want to say is, you are right. You are never the problem. You are the solution. You are the people who love your person most in the whole world. So you get out there with your boxing gloves on and do whatever you need to do and use your local resources. One of the things that can be useful, and it shouldn't be this way because your authority should be unquestioned, is to be able to cite the authority of someone who has credentials. And I love playing that role. So it sounds a bit self-serving to say, but I wrote a book in 2018 called Sick Enough, a guide.
I was going to mention that. Thank you for bringing that up.
And I wrote it for families, for carers, for individuals, for clinicians. And it goes through all of the medical things, or many of the medical things that individuals across gender, age, and eating disorder type and body shape and size can experience. And so to sort of bring that book in and say, now here's a girl who has a lot of letters after her name, MD, SEDS, F.E.A.S.T, what have you, and say, this is real. It helps to break through the stigma and the ignorance that remains so prevalent in the medical system. You can also print off blogs from our website. You can pull off little videolets from my website. I mean, use it. That's the reason that I put it out into the world, is to empower and give voice to you so that you can advocate for your loved one.
Can I just add to that as well, Jen, in terms of actually advocating and self-advocating, there, like, depending on your country and state as well, there are sometimes psychiatric guidelines, medical guidelines that if you as a parent are informed, sometimes they're 1 pages, take them into the hospital and just say, have you checked those as well to support that information? But as a person with lived experience, can I absolutely guide and advise people that, Jen, your little videos that sometimes you've given to, I even understand the medical complexities that someone with lived experience may experience, whether it's the edema, just surges of hunger and all of that have always been in your videos. And I personally have found them really helpful to go, I don't get this. And then you've given these short videos that are not overwhelming, or just these chapters in your book where I go, right, that makes so much sense. So I think as a Bible to almost use and just sort of have as a backup and support, and in some ways a silent advocate, I think it's been a really, really helpful. So even those with lived experience of an eating disorder, it would be very supportive to read or even look at your videos just to understand more.
That's lovely. Thanks.
Shannon and Dr. G, may I call you Dr. G? I need to stop this chat now. We've gone over time a little bit. The time's gone really, really quickly. It's been such a valuable discussion. Thank you so much. For me, what I have got out of this is an incredible sense of, it's an overused word, but empowerment, just that carers and parents have a really valid role to play. They can play it. They have permission. Thank you, Dr. G. And it's innate. And Shannon, thank you so much for your wisdom and calm words around the voice of that individual with lived experience and the inclusion, and just how this could be a time, I think what you were both saying, this could be a time of strength and in fact opportunity. So I think that's wonderful. Thank you very, very much. Gordon, were there any questions? I can see you popping up there. Any more questions that I might have missed that weren't answered?
There was another question. You picked up the one about the attending the emergency department. I noticed that a couple of questions that have come in have been very practical and specific. One of them was around an adult person with an eating disorder moved home for COVID, and they're doing okay, I think is the way I read the question, but they're quite anxious about moving out again and how they will cope with that. Is there any guidance around that?
Shannon, would you like to give some thoughts on that?
Yeah, absolutely. And look, even now, I really do share that experience. I think just even getting out there in the world again, I think it's really just important to acknowledge it. And I think having somebody understand it, reaching out to somebody that you can feel purely vulnerable with, sometimes you can feel like your 2-year-old self, you can acknowledge your fears and your anxieties. And I think, again, the structures and the almost support around the eating disorder itself is crucial and foremost, and there's tools out there to support that. But I think just as a person, just acknowledging this is going to be frightening, and it's taking one, I know just to not sound too cliched, but taking one step at a time and reminding yourself to breathe. And as Jen said, as we both said, go gently. Go gently, but step out there and find someone to hold you along the way.
Wonderful, thank you. We have had some questions that have been directed specifically, and I wonder if we could just pass those on afterwards to the speakers, Gordon. Would that be appropriate? Would you be happy to?
Thank you.
Cool. Thank you.
Thanks all so much.
Thank you all so much. Take good care of yourselves.
Yeah.
One step at a time. You're not going to have all the answers, but you're going to have the best answers anyone does, and keep recruiting people around you who will remind you of what superheroes you are.